Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have sort of a full plate today with a lot of unusual news and access to a new free ebook, which is great. But before we get to it, down below in the YouTube description box, you'll find the link to the Healthcare Advocacy newsletter that is the text for this video. You can like, share, subscribe. It's free, comes into your inbox almost every day, and generally has actions for you to take that make a better system. So let's get started. First, I want to tell you that Healthcare for All, that's an organization that promotes universal healthcare, has developed or is making available Chris Curry's brand new ebook. It's called A Medicare for All Q&A. It's free. You can download it. If you go to the newsletter, you'll find it there, and I will try and get the link into the YouTube description box for you as well. Next, I want to talk about abortion rights in Louisiana. It's not good. Louisiana just indicted a New York doctor for an abortion prescription. The New York doctor was indicted by a Louisiana grand jury last week for allegedly prescribing an abortion pill online in the Deep South state, which has one of the strictest near-total abortion bans in the country. Grand jurors at the district court for the parish of West Baton Rouge issued the indictment against Margaret Carpenter, MD, her company, Nightingale Medical, and a third person. All three were charged with criminal abortion by means of abortion-inducing drugs, which in Louisiana is a felony. The case appears to be the first instance of criminal charges against a doctor accused of sending abortion pills to another state, at least since the U.S. Supreme Court overturned Roe v. Wade in 2022 and opened the door for states to have strict anti-abortion laws. Carpenter has also been sued by the Texas Attorney General last December under similar allegations of sending pills to that state. That case did not involve, however, criminal charges. This could be the first direct test of New York Shield law, those laws are intended to protect prescribers who use telehealth to provide abortion pills to patients in states where abortion is banned. In the newsletter, you'll find a link to the MedPage story on this. I want to talk now about the CDC data that's been removed. I'm not going to post it in the YouTube description box, but go to the newsletter and you'll find links to where much of that data has been archived. The CDC has begun removing from its website words and pages related to diversity, gender identity, or LGBTQ issues, according to several sources that reported to MedPage today. A journalist indicated, just spreading the word, wrote Deborah Bloom, director of MIT's Night Science Journalism program on Blue Sky. The CDC is purging data, so people should archive their favorite CDC data sets today. This was a day or two ago, namely ones that have to do with race or ethnic diversity, LGBTQ, or reproductive health. Also, health data involving climate. Isn't that charming? The Youth Risk Behavior Survey has already gone down. It was unclear whether the pages were being permanently deleted or just removed from public view, but a quick search showed that a whole host of pages have gone missing, and a return note indicating the page you're looking for was not found. I have a whole list of them. I can just give you a brief overview of them. Health disparities among LGBTQ youth, environmental justice, safer food choices for pregnant people is gone. Interim clinical considerations for the use of vaccine for monkeypox prevention, gone. Preventing HIV, gone. Anyway, a whole bunch of HIV ones also disappeared. Anyway, if you go to my newsletter, you'll find links to where they've been archived. The Infectious Disease Society of America and HIV Medicine Association called the removal of the pages dangerous. It takes away information from patients and providers. It's just horrible. Look, let's take an action. We need to stand up to Trump. You can't let this stuff pass. and the Republicans who want to harm so many of us by cutting Medicaid, that's 80 million people at risk, Medicare, school lunches, medical research, public health, the list goes on and on. Everyone is going to be hurt if Russell Vought becomes the director of the Office of Management and Budget. OMB controls the executive branch finances. I have a link. I'll put it into the YouTube description box. You can just call or email your senators and tell them Russell Vought is a danger to all of us. Young, old, working or retired, Republican, Democrat, or independent, he's a risk. That's what I've got for you today. Please take the action. This stuff is really time sensitive. Down below, you can like, share, or subscribe. Contact me here or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.